Welcome back to the Unfiltered by Jade. Today we have with us Dr. John Lipman. He is the founder and medical director for Atlanta Fibroid Center. He has more than 25 years of experience and exemplary medical training. Dr. Lipman is a leader in the non-surgical treatment of uterine fibroids. He has the world's largest UFE experience. Dr. Lipman founded the Atlanta Interventional Institute and Atlanta Fibroid Center to specifically treat uterine fibroids and other women's medical conditions. So, hello, Dr. Lipman.
Hey, thanks for having me.
Sure, no problem. Thank you so much for being on this platform. So, we're here today to learn some things about, freedom from fibroids because so many persons have this, so many women have fibroids and don't know how to go about it. So, you're the expert here. So, thank you so much for being here to answer some of our questions. So, we want to know first and foremost, what are uterine fibroids? We want to know the cause and the effects of this.
Sure. Uterine fibroids are benign tumors, so they're not cancerous.
Okay.
They're very, very common. In fact, they're the most common pelvic tumor seen in women. One of every three women have these benign fibroids, and up to 80% of African American women have these fibroid tumors. And they're made up of smooth muscle and fibrous tissue, so they're very hard and firm to the touch. And that's how they cause their symptoms. They press on whatever's next to them. So it's the most common reason why women have heavy periods. So these fibroids that cause heavy menstrual flow will be located just underneath the lining of the uterus centrally. They can also cause a lot of pelvic pain and pressure. And those fibroids are pressing on pelvic nerves. They can even cause pain called sciatica that's commonly seen when you throw out your low back. Well, the fibroids can press on those same nerves that feel like sciatica. Is it in the low back, buttock, down the leg? Fibroids that are located in the front of the uterus will press on the bladder. And so these women will urinate frequently and often wake up multiple times a night to urinate. And so while fibroids typically won't kill you, they can make your life absolutely miserable. And as I say, it's the most common reason why women have heavy periods. And what is one of the most important things that I will say today is that no matter what your physician tells you, if you have symptomatic uterine fibroids and you're told you have to have a hysterectomy, likely that's false. We do this non-surgical procedure and been doing it here, and it's available throughout the country, but we're kind of leaders in this procedure called uterine fibroid embolization, UFE, and it treats the symptoms of these fibroids very effectively, 90% or more. So women get the relief from these horrible symptoms. They avoid the risks and long recovery of an operation. And importantly, they get to keep their uterus, not lose it. And we can talk about what happens to women when they lose their uterus. But it's information that, unfortunately, despite the fact of having the long track record of safety and efficacy for UFE, most women will never hear about it. So I was happy to get the invitation to come on your show and inform women, because this information is really critical for people to know, particularly women of color who disproportionately suffer with these benign tumors.
Wow. I really want to know what are the reasons for the first option of fibroids really being hysterectomy though? Why is it that they don't give people the other options?
Well, they will usually start with medical options. When somebody presents to their doctor with heavy periods, pelvic pain, and they will often do a physical exam, and these fibroids will enlarge the uterus. And as I mentioned earlier, they are hard and firm to the touch, so they're easily felt oftentimes on physical exam. And so the doctor that's examining the patient will feel these hard, firm tumors. They'll feel that the uterus is enlarged, and they'll know pretty confidently that they're dealing with fibroids, but they'll confirm this with an office ultrasound.
Okay.
And so now they have the diagnosis of fibroids, and now first thing that's typically given to these patients to treat them is usually either an anti-inflammatory medication like ibuprofen or its relative tranexamic acid, or they'll be placed on some sort of hormonal therapy, whether it's an oral birth control pill or a progestin laden IUD or an implantable hormone. So those are the kind of the first line therapy, but uh, it rarely works. If it works, it may be helpful for a little while.
Right.
Um, and while we don't know where fibroids come from, nobody does yet. Once they arrive, they grow with hormonal stimulation, particularly
Okay.
estrogen. So placing these women on hormones like birth control, in a
Makes it worse.
sense, kind of adds fuel to the fire. I mean,
Mm.
it might lighten a woman's flow for a little while, but in the background, it's growing these fibroids more rapidly than they normally otherwise would. And so these women fail after this brief period of, say, birth control, and then they go right to the surgical option. And basically, it's a binary decision from the physician standpoint. They'll say, okay, are you interested in fertility? And if you are, you get a surgical procedure called myomectomy, which is
Okay.
cutting out some of the fibroids. And that's the biggest problem with myomectomy. You never get them all out. And so you subject this woman to recurrent surgeries at an 11% per year rate. Or if they're not interested in fertility, they get knee jerked into hysterectomy. Um,
Mm.
and it really is, irrespective of their age. For instance, hysterectomy is the second most common surgery done in the United States, which is kind of
Wow.
surprising because half the population, men, don't even have a uterus. And the most
Wow.
common reason why we do this hysterectomy surgery in this country is not for cancer of the uterus, which would be appropriate. The most common reason by far are for these benign tumors. And if you look by race, African American women are getting hysterectomies for benign fibroids, while Caucasian women are getting hysterectomy for cancer. So,
For
why
cancer.
are we
Wow.
essentially amputating Black women, young women, for benign disease? Because the average age of hysterectomy is less than 40. And I've met way too many women in my travels throughout the country talking about this topic who are less than 30 that have already had a hysterectomy for fibroids. It's
Wow.
absolutely tragic and
That is tragic.
unnecessary.
It is because, all right, so even watching the video that you have up, the Freedom from Fibroids, I'm watching it and I'm seeing the amount of women who have spoken about going to the doctors, getting an opinion, and the doctors are saying the only opinion is the hysterectomy. And some of them have done other surgical procedures, and then probably after a year or two, it returns. And in my mind, it's mind blowing because if you know of other procedures, why not give the patients this procedure so that they can just be well instead of giving them a procedure which you know that the fibroids will return. It's really crazy.
It is. I mean, it's physicians are obligated to tell the patient all of their options. Women are entitled to know all their options, not just the surgical ones that the surgeon, OBGYNs are surgeons, and surgeons love to operate. Now, some OBGYNs will tell their patients about UFE, but it's been shown in numerous studies, and I see it every day in my office, most gynecologists won't mention it. Or if they do, if the patient happens to know about it, more and more patients are finding out about UFE. So they're asking their physicians about it. But oftentimes, the gynecologist won't give them correct information about UFE, whether they're just misinformed or they're just wanting to operate. I don't know the rationale, but I have patients in my office all the time say, well, I asked my doctor about UFE and they said my fibroids were too big or I had too many fibroids. That's just silly. Those are false statements. Almost every single patient, I mean, it's almost unheard of. If you've been told you need a hysterectomy for fibroids, you're a candidate for UFE. It's almost unheard of not to be. So for telling patients these other things, it's just misleading and wrong.
Okay. All right. So question. I want to know. Women have before misunderstood what fibroids were because of some of the symptoms they're having. Because some of the symptoms that we have spoken about earlier in regards to even the growth in the abdomen and the heavy bleedings, and the constant urination at nights or so. Sometimes they have it and their doctors are telling them it's something else. It's not necessarily um, fibroids that they have. How can we distinguish that, or it is that we have to go to a health professional for them to actually tell us that this is what we have?
Yeah, I mean, usually it's someone you have to go to a health professional to try to get the diagnosis. If you're having heavy periods, you really should see either a primary care physician or a gynecologist. Um, you know, heavy periods are a very significant health issue that's underreported and, frankly, underappreciated by a lot of healthcare professionals. Um, you know, healthcare right now, I mean, it's to see a physician or a healthcare provider, you get very little physician time in
Yes,
most practices. And a lot of times, doctors often won't treat heavy periods if the patient's not anemic based on a blood test. And that's, in my opinion, wrong. If a woman's quality of life is being affected by her heavy
yes.
periods, it warrants treatment. I mean, and there have been studies that show that women that have heavy periods often don't even see a physician because
They
either
think it's normal, actually.
they think it's normal. If you've been doing it for so long, it becomes your new normal and you don't realize that it's abnormally heavy. I have patients, I ask someone if they have heavy periods and they say no. And then when I ask them and get into the specifics, clearly it's abnormally heavy. And so you have to kind of know what is normal. And if you haven't had a normal period in a while, you don't realize. And so if you're changing pads more frequently than every 3 or 4 hours, or if you need to change more than one at a time, you're using multiple pads, or if you're passing clots bigger than a quarter, or you get these
Mm,
episodes of blood
right.
gushing out or flooding, or you have to wear extra gear, or you can't sleep on your good linens, or you're afraid to sit on furniture. I mean, these are things that's way too heavy, no matter if you're technically anemic or not. Um, and so, accidents in blood, any of this stuff, if you have to, wear an adult diaper because
Mm-hmm.
there are a number of women that do that. Those things are not normal. It's obviously too heavy, and you should seek out why that is. And the most common reason for this is fibroids.
I want to know, can you tell us a little bit more about the uterine fibroid embolization? Give us
Sure.
a little bit more detail.
It was discovered in the early 1990s.
Oh,
We've been embolizing cancerous tumors for a long time. We, meaning interventional radiologists.
right.
Interventional radiologist is the medical specialty that treats patients with this uterine fibroid embolization procedure. So they're a different type of physician. We've been embolizing tumors to make it an easier procedure for the surgeon to remove uh, a cancerous tumor. And someone in France got the bright idea, why not embolize benign fibroids prior to hysterectomy
Mm,
to make it an easier operation? And so they started doing that in France. And unlike this country, where if you get a tumor embolized prior to surgery, they're going to surgery that same day.
well,
Whereas in France, it's a socialized healthcare system, like in Europe and Canada. Uh, you have to wait for your elective procedure. So these women were getting embolized by the interventional radiologist in France, and then they were discharged home, and they would have to wait 6, 7, 8 weeks for their elective hysterectomy surgery.
well.
And so what happened? Well, over that 6, 7, or 8 week time frame that they were waiting for the hysterectomy, their symptoms went away, and they started to feel
Mm,
great. And they called the gynecologist and said, I feel great. My symptoms are gone. Do I still need that hysterectomy?
right.
And the answer was no. And that's how this procedure got discovered. And so the first 11 patients that were done in the United States with UFE were done by out at UCLA were done by Scott Goodwin. And Scott happened to be presenting his first 11 patients at a medical meeting that I was presenting my experience in cancerous tumors. And when I heard Scott speak, it was like the light bulb went off. So I knew I was in Atlanta, and we have a large African American population that could really benefit from this, new therapy at the time. This was again kind of the mid 1990s.
Right.
I've been performing UFE ever since, and have one of the largest experiences in the procedure. This is what we do every single day. I've dedicated my life and career to helping these women avoid a major operation, because nobody wants to get surgery. It's been well proven. In fact, they did a study at the Mayo Clinic a number of years ago. They couldn't believe how long it took for people with symptomatic uterine fibroids to get treated. The average time was over 3.5 years, and a number of women waited over 5 years, and they couldn't understand, why are these women waiting? Well, they're waiting because the only option given to them was major surgery, hysterectomy. And so they tried to kind of suffer in silence and suffer with these horrific periods, hoping they would get to menopause for a lot of them.
Yes.
Or they just didn't want surgery at all. That's the only option that was given to them. They weren't given the UFE option, and so they just kind of suffered with it. And it's completely unnecessary. We have over 1 million women in the United States that are in a similar predicament. They're suffering with these horrible symptoms from fibroids, and we have the answer. UFE can give them their life back. It's transformational. I mean, you watch our documentary, you saw these women that literally had their lives transformed from everything they did revolved around their menstrual, if they worked or not, if they had relations or not, if they went outside or not, to complete freedom again. I mean, it truly is freedom from fibroids.
It is. For persons who want to know the steps of embolization, can you give that to us?
Sure. I mean, basically the access is at the top of the woman's right leg, kind of in the crease. You can feel your pulse. That's our entry point into the body. Now, you can use other entry points. One other one is at the left wrist. But once you're inside, there's a uterine artery that supplies the uterus on each side of it, kind of a left uterine artery and a right uterine artery.
Yes.
And they're each of them can be thought of as a tree, and the tree kind of branches and gets smaller and smaller branches till you get out to the peripheral branches, which are, where the leaves of the tree are. That's where the fibroids are. And I know what size those small peripheral branches are, and I can plug them up with this inert particle called PVA. It's the material contact lenses are made out of. So it's completely inert. It doesn't react in any way. And particles are made of different sizes, and I know what size to use and can plug up these tiny vessels. And then without a blood supply, the fibroids will die. And as the fibroids die, they soften and shrink. And as that happens, a woman's symptoms go away. Now, the big trunk and the main uterine branches stay open, so the uterus stays alive. In fact, we've had numerous children born after UFE. I've had multiple sets of twins
that's what I was going to ask. Yes.
So our births are typically full term and vaginal, whereas if you have a myomectomy surgery for fibroids, you're going to get a C-section, more surgery. They won't let you have a vaginal birth. So that's how it works. You cut the blood supply off to the fibroids. Every fibroid in the uterus is affected and treated. So it's usually a one and done, particularly if a woman is over 40 when she has the embolization, because by the time she could ever, grow new fibroids, she'll be in menopause. So while younger women occasionally will need a second procedure, it's unusual. The vast majority of people, it's one procedure and that's it.
Nice. I've since watching the video, I've realized a number of them had said they go in and they come out the same day. And they get back to their lives like in about 2 weeks or so, or some even less.
Yeah, not even. I mean, the patients, the procedure takes me somewhere around 30 minutes or so.
And that's what a lot of them couldn't understand, because they're saying they woke up and they were like, "Are you done?" And you're like, "Yeah, we have done already." So it seems simpler.
It's very simple.
It doesn't seem as if they also have a lot of pain After.
Some women have pain after, although we've gotten a lot better at preventing a lot of that significant pain. We still see some women that have a couple of days of, rough go, if you will. But the number of patients, we used to see that fairly commonly. We don't see it as much anymore because we've learned over the past several years how to really try to mitigate a lot of that pain. They'll still have some pain, but it's typically very manageable now. And so pain, you might hear that some people have a rough go, but it's usually places that don't do a lot of UFE. And the more experienced places like the Atlanta Fibroid Center where I'm at, it's very unusual to see a woman that has a rough go anymore. They get pain, but it's very manageable. So the procedure is brief and there's a several hour recovery. And so they're discharged after several hours with a Band-Aid. That's
Yes.
it, a
Yes.
Band-Aid. And, we saw a woman recently, and we see these women commonly, where their uterus is so big, it's above their belly button. And
Wow.
so she wasn't interested in fertility, and she was looking at either a UFE, where she goes home the same day with a Band-Aid, or cutting her vertically from her breastbone
Oh
down to her
no.
pubic hairline, vertically,
Mm-mm.
all the way down her belly to her pubic hairline from her breastbone. Being in the hospital, cut open, as they say, that
Mm-mm.
all the way down vertically, being in the hospital for several days minimum, and then a 2-month recovery at home, and she loses her uterus
Wow.
versus UFE, where she's home the same day with a Band-Aid and
Yeah.
about a 5-day recovery at home.
I mean, that's a lot of information, and even saying it, even hearing it being said, I'm like, that's why you have a lot of women don't want to go in to get any operation done,
Right.
and it's
And despite all that, I mean, women, unfortunately, just because they're so tired of dealing with it, I get it. It's miserable. They just kind of give up and say, okay, you win, take my uterus. Because the gynecologists oftentimes tell them that once they're done having their kids, they really don't need their uterus anymore, which is, again, a very false statement.
mm,
And a lot of women are, under that belief because they've heard it so often. But there are a lot of consequences for women that lose their uterus. There are women that struggle psychologically, like a man being castrated. There's
right.
a lot of sexual dysfunction, and we don't like to talk about it because it's embarrassing, but loss of libido, loss of orgasm. There's a lot of urinary leaking. You go to
Really?
any, drugstore or large grocery store and go to the health section, and you go to see where the adult diapers are. I'm thinking you're going to see a picture of grandma and grandpa. No, likely you're going to see an attractive 30-ish, maybe 40-year-old African American woman on the cover of those diapers because
Wow.
they know exactly who their target audience is. Their target audience is not grandma and grandpa. Their target is the very common woman that's had a hysterectomy, and you've taken this big fibroid filled uterus out of the pelvis, and now she leaks urine and has to wear an adult diaper. It's absolutely tragic, but they know who their target is. There's no doubt.
That is sad. That is absolutely sad. And I'm saying, do they tell these women that this is what the outcome is going to be, or they just go ahead
Well,
and say, "Oh,
they will commonly tell a patient what the surgical complication is for hysterectomy. Well, we could get into bleeding. It's very common to have bleeding intraoperatively. We may have to transfuse you. There's a small risk of infection or wound issues. Um, they'll tell them they may nick a critical structure, the surgical complications that may delay their recovery. But what they often don't tell patients, as I mentioned earlier, is what happens to a woman when she loses her uterus. They think it's no big deal because once they have their kids, they don't need it anymore. That's wrong. There's, as I mentioned, there's psychological consequences, sexual consequences, bone loss. There's a lot of bone loss after hysterectomy and urinary leaking. So they don't often mention what happens to you when you lose your uterus. They often just mention the surgical complications, which is woefully inadequate.
I mean, hearing this is sad. I'm just gonna say, hearing this is really sad. I'm also wondering. I'm not sure if you can say, but I'm wondering. the same method used for the fibroid, can it be also used for persons with PCOS?
Not for PCOS, but we can use it for women that suffer with when endometriosis involves the uterus.
Okay.
It's called adenomyosis.
Okay.
It's a common condition that is often mistaken for fibroids, particularly when it sometimes comes in a focal form in the uterus, and this focal form of adenomyosis can look like a fibroid, and commonly it's misdiagnosed as a fibroid on the ultrasound that is done in a gynecologist's office. So we'll often see women that have the diagnosis of fibroids and have adenomyosis instead. You can still treat those patients with embolization, the same
Right.
procedure you do for fibroids. But when endometriosis is found outside the uterus,
That's a different.
that's a
That's
different
a different
matter.
ballgame.
So we can treat conditions of the uterus with embolization, but ovarian issues like PCOS or traditional endometriosis, which is defined by being outside the uterus, we can't treat with embolization.
With embolization. Okay, understood. What I want to tell you though, Dr. Lipman, is thank you so much for being so interested in helping the Black woman, especially, to deal with this. It's sad that they're really targeting the Black women, especially with these kind of surgeries to be done, and don't even send them the risk, because what they're basically doing is taking away their lives from them, actually, and making it seem as if you're giving them a better life. So thank you so much for even this method that you're doing, and I'm very sure you're doing a great job. I've done my research. I have seen the good work that you have done, and you have given back life to so many women. So
Well, I
thank you
really
so much.
appreciate that. And I may say it, unfortunately, there is as you're well aware of, the kind of history of, the treatment of Black women. Um, it wasn't that long ago, probably about 60 years ago, that Fannie Lou Hamer coined that phrase, "I'm sick and tired of being sick and tired." And
Mm-hmm.
she had a hysterectomy without her consent for fibroids. And, it coined the term Mississippi appendectomy, kind of this sterilization of typically poor Black women under kind of this pretext of treating, gynecologic issues like fibroids. And it's really a failing of, our healthcare system. It's just one of many health disparities, and it's it's unnecessary. We have to stop this. In fact, I spoke about this very issue at Tuskegee University. It's not far from Atlanta. I wanted to kind of see, kind of go there. It was a really incredible experience. I mean, imagine, I'm a Caucasian male talking to a large audience of hundreds of African American young women about the Tuskegee experiment at Tuskegee. Um, and the talk was basically, the premise was, the Tuskegee experiment was horrible and everybody knows about it. It was done, for those that didn't, it was young, poor, African American male sharecroppers that
Wow.
volunteered, that had syphilis, that volunteered to be studied. We didn't have any good treatment at the time for syphilis back in the 1930s. They volunteered because they were poor and they got free health care and a free lunch. And then over the course of the trial following these gentlemen with syphilis, penicillin was discovered during the Second World War. And the problem was, the medical people that were following these gentlemen, they never told them about this, even though they could have cured their syphilis with
Whoa.
penicillin. And my premise was, I have, in a sense, UFE. This would take care of fibroids. Got
Yes.
all these Black women now. It's not men. This is a Black women, and it's not necessarily poor Black women. It's women of all socioeconomic,
Yes.
condition. But I have the penicillin for fibroids, and yet, for the most part, most physicians are not mentioning it. Just like they didn't
Wow.
mention about penicillin, they're not mentioning about UFE. I mean, it has, somewhat eerie parallels, and it's very disturbing.
Well, we're here to help push that so that more people can be hearing about the UFE. and because people need to know about it. There are too many people who are suffering in silence and don't want to
Absolutely. I
speak up.
mean, hysterectomy is an option for fibroids, but it should be the option of last
Last,
resort,
yes,
not first and only option. That's the problem. It's being pushed out there as a first and only option, and it should be the option of absolute last resort because UFE is so good. I mean, the success, as I say, is a little bit over 90%.
that's good. That's really
It's
good.
absolutely outstanding.
That's really, really good. And for persons who may be saying, I don't know if I can afford to do this because it sounds expensive.
If you were paying for this yourself, it is rather expensive. I mean,
Right.
less expensive than paying for surgery in the hospital,
Wow.
but it is expensive. But it's covered by all insurances,
Insurance. Okay. Okay.
including Medicare and Medicaid. So
Nice.
all insurances cover it. So it's, but yes, if
Out of
there are
pocket
a
is
number
going to
of
be a little
people
bit
that
more expensive.
can't afford insurance and they're not quote poor enough to be considered for Medicaid. They're kind of trapped in kind of the working poor
Right.
in this country often can't afford health insurance, and it is a real problem. Um, you know, the Affordable Care Act really was kind of unfortunately didn't provide this to people. It gave them insurance, but the deductibles for the most part are so high that they have
Yeah.
insurance, but they can't
But
afford
they
to
can't
use
afford
it.
it. Yeah.
So it gave
Yeah.
the politicians, we gave all these people health insurance that didn't otherwise have it. Well, congratulations, but the real story is they can't use it.
They can't use it.
Their
They can't
deductibles are
use
too
it.
high.
Makes
You
no
can give
sense.
somebody insurance with a $5,000 deductible, but most people don't have $5,000
$1,000.
to contribute till they get their insurance to kick in. So it's
Hey,
kind of it was kind of a game, and I still have patients that have these plans that come to the office not realizing they think they have insurance, but they really don't.
that is sad.
Very sad.
That is sad. I mean, they think that they have something that can help them with it, and then when they reach there, totally can't. It's absolutely sad. Absolutely sad. But I want to know, doctor, how is it that we can reach you? And if persons want to have consultations with you about this, how is it that they can reach your office?
Well, I'm pretty easy to find. My office phone number, we're based in Atlanta. It's the Atlanta Fibroid Center. We have a YouTube channel, Atlanta Fibroid Center, that has over 150 videos they can watch
Yes.
on fibroids and on the UFE procedure. My office phone number is 770-953-2600, 770-953-2600. We have an Instagram page. A lot of people like the Instagram. It's dr underscore my last name. So it's dr underscore Lipman.
Nice.
And finally, we have a Facebook page for those that use Facebook. That's Atlanta Interventional Institute. That's the original company that oversees the Atlanta Fibroid Center. Oh, and our website is probably the best as far as information, and that's atlii.com, atlii.com.
Nice. Nice. So thank you so much, Dr. Lipman. And guys, listen out there, I'm asking for those women who are suffering in silence, this is an opportunity for you to no longer suffer. It's an opportunity to go and get this procedure done. Call, get the information that you need, get the consultations that you need, whatever information, it's there. And you can even watch some of the YouTube conversations that has been done there. You will see different women who have been speaking about before and after, and how this procedure has given them back their lives. So as I'm saying, Dr. Lipman, thank you so much for this procedure. Thank you so much that you're going ahead and you're so invested in it, because we Black women do need this help. We absolutely need it. So it's really, really appreciated. I mean, I didn't know about so many things about it until I watched that video. And
Well,
it's
I
because
really
we're
appreciate.
really not we're really not educated so much about it, and we don't do I don't think we do enough research to find out other ways that we can go about getting rid of fibroids, or other you know other illnesses or other things associated with this, because we see these things and we probably say, okay, it's normal, when it's really not normal, and we see it's disrupting our lives, but sometimes we do nothing about it because of embarrassment or
Right.
fear. Right.
Exactly. I mean, there's been, a woman's period, there's a lot of kind of social stigma associated with, having a period or having a heavy period, and people don't like to talk about it. There is unfortunately a lot of, period issues globally. A lot of
Yes.
women don't have the means to have adequate,
Yes.
period hygiene, and we contribute internationally to an effort that provides sanitary products to young
Nice.
girls in Africa. We also provide here locally for a group, a woman, she's phenomenal, who started this group called You First, who provides hygiene kits for poor and the homeless. And we provide the sanitary products for her hygiene kits, but she puts them all together and delivers them out to the community. She's a real angel in our community, Erica
Nice.
Wright, and You First. So we try to do what we can do to help, but there's a global real problem with period poverty, and so many women don't have adequate sanitary products, and even in those that do, there's a lot of social stigma around a woman's periods, that we really need to increase the global discussion about
Yes.
periods,
Yes.
and the normalcy of it. And men need to understand about a woman's period, because so
Yes.
often women, go through this stuff, and the men are just kind of ignorant about a woman's periods. They don't want to know anything about it. But believe me, if it affects a woman you care about, it affects you too. And you should
Yes.
know about it and know how to empathize with what she's going through.
Most definitely. Thank you so much again for being on the podcast. Truly appreciate you being here, honestly.